past few days, we have discussed a lot about HMPV or human metapneumovirus. Again, we are here to discuss this, but to wrap all the unnecessary panic, especially after yesterday when WHO, World Health Organization, has clarified a lot of air on HMPV. Today, to discuss this, I have with me brilliant Professor K. Srinath Reddy, who is a founder president of Public Health Foundation of India and also member of government's technical task force on COVID-19. Thank you, Dr. Reddy, for joining us.
Thank you. Pleasure to be with you.
Thank you so much, sir. Sir, I will start with a request to explain to our viewers the clarification that was issued by the World Health Organization yesterday on HMPV.
The World Health Organization clearly informed people that the outbreak of HMPV cases among children in China is not an unusual occurrence. It is an expected happening of multiple respiratory infections happening during winter time. And HMPV is one of those microbes that causes upper respiratory infections, especially in children. And they said that there is no need for panic because there is no unusual increase in hospitalizations. While parents may have been anxious to take their children for medical examination, particularly because the memory of COVID is still with us, that this is certainly not the start of an outbreak, certainly not going to be resulting in a pandemic. So WHO was really allaying anxieties by pointing out to an anticipated seasonal pattern, which is not unusual and therefore should not really be seen as something of an extraordinary occurrence.
Right. And also WHO has clarified that, in fact, HMPV is not the leading virus that has been causing illness in China. It is seasonal influenza, Dr. Reddy, I believe.
Yes, because there is a spurt of multiple respiratory viruses during this particular period. And influenza viruses, other common cold viruses, and HMPV, respiratory syncytial virus, all of these are there as a part of the mix. And HMPV is not really contributing to a very large proportion of these cases either. So WHO did point out that given the frequency of viral infections in winter, especially among children, that HMPV is one of the minor contributors, not the predominant contributor.
Right. And in fact, the UN Health Agency has clarified that the utilization of hospitals right now in China is lesser than the last year. So there is no reason to create an alarm or be in panic mode. There is no alert at all. However, as I move to my next question, Dr. Reddy, was this the unique name, human metapneumovirus, or the timings, December, or the country, China? What was there that triggered the anxiety so that, the world started imagining that we are on the onset or we are here to see next pandemic?
Well, I think all of the above, all of the causes. Certainly, whenever you hear of a new virus outbreak, or at least what is considered to be an outbreak, coming from China, the whole world is very alert because we are really still to forget what happened during COVID. The memories are still very much with us. And therefore, there is always a worry that a new virus is emerging. And the fact that this is not a new virus is something that was not clearly recognized because HMPV has been known for quite some time, for more than 50 years now. And perhaps it existed for many more years before that, even before it was recognized to be an important contributor to upper respiratory infections. But the fact that there is a virus outbreak among some children coming in China in winter sort of triggered the alarm. But the WHO has rightly clarified that this is an expected seasonal occurrence. The incidence of these infections is no more than expected. And certainly there is no reason to anticipate even a widespread epidemic in China, leave aside a pandemic. And I think that reassurance has been very, very helpful.
Right, right. So now we understand that HMPV is not a scary virus. Considering this, do we still need to mask up again? Some states have issued the advisories saying that we need to mask up once again. What do you think on that?
Well, there is really no need to mask up because masks are mostly protective when there is an aerosol spread. Like in the case of COVID, there was a definite aerosol spread, and the virus could be occurring in clouds in air anywhere around. And therefore, you, as you're walking through, you never know when you're walking through a cloud of virus. So you required to wear a mask. Whereas this particular virus spreads almost essentially through droplet spread, which means that somebody coughs or sneezes, the droplets of sputum fall on another person or fall on some objects, whether they're clothes or whether they're other objects, and another person may be touching them. And therefore, through contact, direct contact by shaking hands with somebody or speaking in close proximity with somebody who is infected and being subjected to a spray of their droplets, or touching objects which have been touched by the other person who has been infected, these are the ways in which the virus enters the body. Now, masks are really not needed in these cases. What you need to do is to wash your hands frequently and make sure that you're not touching somebody who is having a cold or a cough, any upper respiratory infection. And if you're actually going to be having a conversation with somebody who has a cold or a cough, keep a safe distance so that droplets from that person do not fall on you.
Right, right.
But there are some people and some occasions when you may benefit from a mask. There are elderly people, people with immunocompromised states, or people with severe comorbidities, with hypertension, diabetes, who are respiratory disease, who may be at a higher risk if infected. And if such people are traveling in crowds, for example, in a bus or a train, then you may actually be subjected even to droplet spread. So you might want to protect your nose and throat by wearing a mask. So there are occasions in which a mask, particularly in crowded places, is helpful. But a mask is not mandatory for everybody.
Right. Okay. So people have been asking this question to me as well a lot. People got really confused when states started putting numbers like reporting cases, first case detected, second case detected, so on and so forth. So, what was that?
See, again, this was born out of fear. As you rightly pointed out, the name human metapneumovirus sounds very frightening. People are not used to it. Even doctors have not heard much about it, leave aside the people and the media. So when you say a new virus or with a strange name is coming up from China, then everybody is a little scared and they say, okay, let us find out what's happening. And even if one or two cases get reported after the testing, then that becomes big news. And people say, okay, there's going to be an outbreak. We don't know what's going to happen. So I think it was that fear psychosis that really triggered that response. As you rightly pointed out, the lack of familiarity with the name, the lack of familiarity with its seasonal pattern, and the fact that even in China, there is no real surge of hospitalized infections. All of this was forgotten, and the fright really surfaced much more.
Right, right. So, okay, we got it. It's not HMPV, but scientists across the globe are still searching for the pathogen which will cause or trigger the next pandemic. How can we prepare for that?
Well, we know that we are living in an era of increasing frequency of zoonotic infections, infections transferred from animals to humans, particularly viral infections, because we have sort of destroyed the natural boundaries which kept those viruses confined in the wild animals of the forest. By removing those natural defenses through deforestation and by extensive animal breeding, what we have done is allowed the viruses to travel from the wildlife into captive veterinary populations and from there into the human habitat. So we built those conveyor belts. And given the frequency with which the zoonotic infections have been occurring over the last 60 years, in fact, more than 2/3 of them are of all new infectious disease outbreaks are zoonotic in origin. We have to anticipate that this is going to happen again. We are still seeing a lot of deforestation going on. We are still seeing a lot of mining going on. So we are going to definitely see more zoonotic infections coming in. We have to make sure, firstly, that we have a good surveillance mechanism, what's called One Health surveillance, where the microbial surveillance in wildlife, in veterinary populations, as well as in human communities are all linked together by common surveillance data. So we know fully, for example, if something that is happening in animals which are captive bred, like if, for example, sheep or pigs or chickens are getting infected in much larger numbers, and the virus seems to have traveled from forest into these animals, then we know that it could easily spill over into the humans. So we need to build this kind of a connected surveillance system called One Health. And we also know that climate change is going to increase this process, not only because deforestation is common to climate change and zoonotic infections, but also extreme weather events is going to lead to migration of people and animals. So there's going to be very unusual admixture of people and animals, which has not happened before as a result of climate change. So for all of these reasons, we need to build very robust surveillance systems. Second thing, of course, is we need to build public systems of good health protection for people. We need to make sure that we have early detection mechanisms in primary healthcare so that even when people are becoming ill, we have very clear evidence of what's happening to them and then how to take care of them and protect them before serious complications develop. And even advanced critical care facilities would need to be developed. Therefore, we do need very robust health systems, but particularly primary care is going to be very, very important, whether in urban areas or rural areas. Third, of course, we need to build in our capacity, technical capacity for vaccines, etc., and for drugs. All that needs to be done. But very importantly, it's very critical for us to inform people how to protect themselves. Firstly, how to protect themselves by ensuring that they are not exposed unnecessarily to people who are unwell, particularly with respiratory infections, and how to protect themselves. What we call the COVID appropriate behavior is very applicable here. The cough hygiene. How do you actually cough or sneeze with your face, nose covered? How do you ensure that you're not unnecessarily shaking hands? How do you ensure that you're keeping at a little safe distance? How do you ensure that you're washing your hands frequently? So preparing people, preparing health systems, and preparing surveillance systems is going to be critical, apart from producing vaccines and drugs.
As we discuss this, how far are we in terms of preparation? Because you are also member of certain committees at several levels in Government of India. I understand that we have started this process, but are we there? Have we covered some journey so far in this?
No, I think firstly, whenever a new pathogen appears, then the response of preparing vaccines or drugs will have to be according to the nature of that particular pathogen.
Right.
But I think a lot of work is going on now in order to make sure that we have the infrastructure available for a ready response. So if we are going to be having a particular pathogen appearing, the lead time for preparing a vaccine can be greatly shortened. The lead time for preparing appropriate drugs can be greatly shortened. So to that extent, I think there is a tremendous amount of investment that's happening in our infrastructure. Particularly, you have seen also when COVID came in, not only the virus vector vaccine, which was imported from outside and then produced in India, but we produced our own inactivated virus vaccine. So that way, I think there is a tremendous amount of investment that's going on now into ramping up our infrastructure for vaccine production and drug production.
Right. And also we have mRNA technology that we say that can be tweaked very easily and at a faster way.
We have multiple platforms now. We have everything from mRNA and DNA vaccine to virus vector vaccines and inactivated virus vaccines to protein subunit vaccines. Protein subunit vaccines are the easiest to prepare, and we have a lot of experience with that. Even inactivated virus vaccines, we have a lot of experience with that. But other platforms we have really built up over the last 4 years, and now we are capable of using multiple platforms as per need. Now we are even talking about nasal vaccines. So there are multiple ways in which we ought to be able to respond if vaccines are needed. And we can also produce drugs in large amounts if we need specific drugs. But I think most important is to emphasize on preventing the spillover from forest animals into wildlife, from wildlife into veterinary population and human population. We have to have that ecological sanctity to prevent that kind of spillover. Secondly, we need strong surveillance systems to detect as quickly as possible when spillover occurs. So that's why we require One Health surveillance connecting wildlife, animals, and humans. Then we need strong health systems from primary care to critical care units, but particularly primary care. And then, of course, we need to have very strong healthcare infrastructure, not only hospital care, but also preparing vaccines and drugs as per need. But all of these are going to be important, and we need to invest in that for a possible future pathogen.
Right. Thank you, Dr. Reddy. That was very informative. So now we know that HMPV is not scary. It was living with us for the last many decades. And fear psychosis was the main thing that was playing the role. And So it's a wrap. We now know everything. WHO has cleared the air. Dr. Reddy has also cleared the air, saying that not only 2001, we knew HMPV from much before. Thank you, Dr. Reddy, for sharing quite a useful, informative information with our viewers. Thank you so much for your time, sir.
Most welcome.